Morning. Happy Saturday, everybody. Welcome to all of you joining. We have 3 formats here. So welcome all of you to our Natural Health News Live show. I am actually not mic'd up for YouTube. Hold on one second. It's been kind of chaotic here. Let's see. Here we go. Good morning. Hello, YouTube. Sorry about that. Okay, so welcome to all of you to the Natural Health News Live show. For all of you new joining, welcome. I hope you'll follow, subscribe, like, and share this video. And today we're going to be talking about some latest CDC, some additions to the symptoms to look for if you think you or a family member might have COVID-19. And we're also going to be talking about one of the most important at-home medical devices, and it comes in the cute little carrying kit, and basically a Pluse Ox is going to be what we talk about today, because I really honestly feel like this is going to be such a great resource and tool for you if you do have it, or if you end up coming down with it, and just to monitor your oxygen levels, knowing that this primarily addresses the respiratory system. So welcome to all of you joining. We have Facebook new, so welcome Facebook. This is going to be a live show that I do Saturday and Sunday. Monday through Friday, Gabriel has my mini iPad. So on the weekends, I get it, and you guys can join me for this Natural Health News show. So before we get kicked off, I want to first toast to everybody. We've made it through, I think we are going on week 6. So welcome and cheers to all of you. I made a green smoothie actually with our sponsor, Vegetox. Vegetox is a wonderful super greens. I want to mention them because you guys know I love my greens. I love green powders, and they actually have 8 powerful superfoods in their blend. And they have a little recipe on the back. I altered the recipe a little bit, but I actually used oat milk and some coconut almond milk, as well as just a banana and blueberries, and then the green powder from this. It's so powerful. So I want to list for you the ingredients that they have. So it has wheatgrass. And if you are like me and weekly you get wheatgrass juice shots at your local green juice vendor, you're feeling a little deprived. So I'm back into my wheatgrass juice. So I have wheatgrass juice, barley grass, chlorella, spirulina. That's so powerful. Moringa, you guys know I've talked a lot about the tree of life and the moringa benefits on our heart health and our just stress levels. And it's a very good immune regulator as well. And then it has maca, that'll balance stress. It has camu camu and baobab. Fabulous stuff. So I want to thank the Vegetox Super Greens company for sponsoring this video. Let's give them a thumbs up. You can find them on the link down below. This is actually manufactured in the UK, and oh, it's so fantastic. It tastes honestly better than any green powder I've ever gotten here in the US. So cheers to us for surviving the quarantine mode. So welcome. The recipe. So where you buy it, it is, I posted it on YouTube in the description box. Facebook, I'll come back. And Instagram if you want to DM me. But you go to www.vegatox.com, and it does come through customs. This was really delivered pretty quickly for us, considering the fact that quarantine is kind of slowing things down. But okay, so here, the recipe, I'll give you this recipe because green juice is very healing, very powerful. I did a very healthy scoop. So they say teaspoon. I actually did a little bit more. I go a little intense on my greens because I really feel like now more than ever, I need green juice. And we actually missed our delivery of our regular CSA provider. So I didn't get a lot of my greens this week. So I did actually a tablespoon, healthy dose, about a cup of, so about a cup and a half in total of liquid. I used what I had left of my oat milk, which was about half a cup. And then a combination, I have a coconut and almond milk combo, and that has some extra proteins and stuff in that. So I added a cup of that. And then literally, like I have a banana that was kind of close to going bad, I put half a banana. I had blueberries in my freezer, and actually my blueberry bush is coming up pretty soon. But I grabbed a big handful of blueberries and then the green powder, and that's it. And it's really delicious. So again, I want to thank them. They are bringing this content live to you all. And without our sponsors, this is challenging in this world where YouTube's censoring. Facebook hasn't censored, but YouTube's censoring. Amazon's cutting all their affiliate programs, and it's just challenging. So our sponsors allow me to bring this content to you. So I'm grateful. So let's go over some news. First of all, with Facebook, all of you joining, thank you for tuning in. My normal rig for you all, I didn't get a screw for this like setup that I had. So you guys are kind of set up a little bit differently than what I had planned. But just so you know, the format of the live show, and for all of you new joining, this is how it goes. I go over health news, statistics, data about the current state of the virus, numbers, where states are, highlights from just, news, any of the research or clinical information that could be impactful for you all making healthy decisions for you and your families. And then I go into the second part of it is specific to some way to keep you and your family healthy and safe during our, this time of quarantine, social distancing, self-isolation. And today the topic will be about how to use or a device that I really think everybody needs to have. And we'll go over this a little bit further. And particularly it's highlighted by the CDC, the new edition of symptoms that they added. So anyway, let's dig into the news, friends. Okay, so the US is at 927,000 cases that have been tested, and they have tested positive. Again, testing is not where it needs to be. And out of the 927,000 cases, we are now at 52,400 fatalities. That makes up a quarter of the global death toll. Obviously, the US is leading the world in the cases of this. It's just out of control here in the States. And even with the lack of testing, some people are saying we need to be testing 750,000 people up to 2 million a day. We're not even doing that in a span of 2 or 3 weeks. So I'm watching numbers. New Jersey did surpass 100,000 yesterday. They were really close. They're at 102,196 cases. Massachusetts crossed the 50,000 threshold. So Massachusetts is on the way up. California is at 39. Florida, I grew up in Florida. I'm always watching them. They had over 1,000 cases logged yesterday. They are now over 30,000. And Georgia's just being crazy. Yesterday, you could get your hair and nails done. You could get a massage, and you could grab, get a new tattoo. So I'm sure there's probably people grabbing or ordering up coronavirus tattoos. Totally unsafe. I spoke with a PT therapist friend of mine who, was like, what are your thoughts? And she said, I'm not opening my clinics. And I said, same here in terms of, seeing patients. And the challenge we both concurred was that even getting orders for PPE, it just is not easy, and hospitals are lacking this. How are we're in the medical field, but how is a barber shop or a massage therapist going to get that equipment, let alone the cleaning supplies? So there are it's not very well thought out in terms of the rollout here. Hopefully all of your states, if you guys are watching from another state, will learn and hopefully roll out better. But, there are requirements on business owners to get certain materials and cleaning supplies, but the challenge is the supply and demand. It's very, very hard. So anyway, I just want to put that out there. I have to take a quick little swig. This is my morning breakfast today. Okay, so let's talk about nursing homes. So nursing homes are definitely seeing a major brunt. They're bearing the brunt of this in a multitude of ways. We're seeing greater instances of cases, clusters in nursing homes. We're also seeing the healthcare workers being, one, they're not equipped with, the medical resources. They're not hospitals or nursing home facilities. Two, they don't have all the PPE required. They haven't had that from the beginning. And even still to this day, they're being challenged with the protection. Something that we are not totally tuned into is that if a nursing home patient moves, they get so severe, they move from a nursing home to the hospital and they are released by the hospital, the nursing home has to take them back. And we already know that even though you get released from the hospital, you can still be shedding the virus and still be contagious. That's posing a challenge in the nursing home world. And there's actually a case right now for Facebook. I've been highlighting a little bit. We're going to start to see more lawsuits, legal action happening as it relates to companies, healthcare facilities, states, countries, airlines. I mean, the lawsuits are happening in terms of the liability for the employees and even mostly their civil suits. So there's a nursing, a CNA in a home in New Jersey. So this is based in New Jersey. A CNA, her family actually filed it. A CNA died from the virus because there was a gentleman who was in their home, had the virus. He moved to the hospital, got the care, recovered, and was then released. Well, they had state laws, they have to take them back. And the CNA's family filed suit against the company that owns the nursing homes. And the basis is she was exposed, she wasn't provided the right equipment. So this is something that we're going to have to monitor and assess. The other thing to note right now, we have data that 20% of healthcare professionals are testing positive with the virus. That's pretty significant in terms of, 2 out of every 10 medical professionals are going to be, the likelihood is that they'll test positive. Well, one of the challenges is if, let's say you're ER, there could be anywhere from 15 to 35 people in that space. And these 20% of them might end up having not just exposure, but they might come down and test positive with the virus. So that's a challenge on a lot of different fronts. But the other thing that I wanted to highlight is that the World Health Organization came out, they released, actually it's today. It was early this morning in Europe. They came out with a statement saying that there is no evidence that if you test positive and recover from coronavirus and you show antibodies to this virus, that does not mean that you're protected. And their statement was to my mention, I think it was yesterday. I mentioned, was it yesterday or the day before? It was the day before, 2 days ago. I mentioned the Delta CEO had been interviewed on CNBC, and his comment was that it was very general, and it, there's a lot of backstory potentially to it, but his comment was that, there may be a situation where traveling might require an immunity passport. Okay, so the World Health Organization actually said and warned against immunity papers, that, just because we're looking at potentially better testing in terms of the antibody testing that will potentially show a lot of us were probably asymptomatic and have antibodies or had some degree of exposure, but didn't demonstrate symptoms. And then, by the way, we're going to go over new symptoms to look out for, because a lot of folks are showcasing certain symptoms that aren't necessarily lung respiratory related. So the World Health Organization really wants people to be cognizant that just because the antibody testing is coming out, that our bodies might show antibodies, that does not guarantee or mean we are now immune. So that whole idea of herd immunity, also we need to table that, because we just don't have any evidence right now that antibodies minimize your risk of exposing yourself again or having it again. I reported about, and I want to go back, this is like my notebook of every show, every report. I want to go back to, it was like a week or so ago. Seoul, Korea was showing that there were, let's see here. Seoul, Korea showed it was something pretty phenomenal that there were cases that were coming back. They had tested positive, recovered, and then they came back and were testing positive again. And it was substantial. It was like 20 or 40%. I can't find it now, but that is something we need to be aware of. And that really scared a lot of people. I had a lot of you comment, oh my gosh, the immunity passport, like, what the heck? What does that mean? So just know that is the World Health Organization is cautioning against that. So I want to take a quick pause. Please hit the like button if you guys are liking this over on Facebook, same on Instagram, particularly on YouTube. I really appreciate that. And then also, if you want to share specifically details to friends and family, this is quite helpful, especially on Facebook. That helps create more awareness on this matter. The other thing that I want to highlight that we're going to hear more of is that there is a food crisis in the world of food manufacturing, but even further than that, growers of food, the dairy, farmers, dairy, I don't even know what they call them. And I have family in this category. Angie, one of my cousins is watching. Angie, what do we call our, the Mullen boys that do they have cows that they milk? Dairy farmers, I guess is what we call them. But all of the food, there's a disconnect right now. There are farmers that are looking at potentially having to plow their foods or plow their fields that are fresh and ready for food production or food picking. And yet the customers, the amount of, their buyers have dried up. So some might sell direct to restaurants. Well, restaurants aren't open. So that is going to be a challenge. And we're starting to see that their cries to the federal government for help to turn the switch to moving food instead of to the restaurants to these food banks. We're seeing a massive explosion of people heading towards food banks that literally don't have food. And it is heartbreaking and heart-wrenching that this is a basic requirement. And the requirement and necessity of food, we have food being produced by people, and yet there's a gap between getting it to the people who need it. And I've heard some horrible cases of, pig farmers, they had to euthanize. They didn't have to, but they chose to euthanize the little baby pigs. I am not vegan or vegetarian by any means, but I definitely lean that way. And we don't eat any pork in our family. And it just breaks my heart. So it also breaks my heart that in Texas, there's 10,000 families that line up on a weekly basis to get food, basic requirements. Same up in New York, and it's all over the US. And also we're going to be seeing this also all over the world. So I want to put that news out there. Okay, so I want to go over some additions. So the CDC, okay, and I know you guys are, I'm seeing a lot of feed hate on the World Health Organization and the CDC. Them being what they are, regardless of your thoughts, they are thought leaders, and they have clinicians and scientists that are some of the best experts in the world. So I don't want you to completely disregard everything that's coming out of there. And as to yesterday's video, I have to remind each and every one of us, and I sometimes have to remind myself, we need to lower our expectations about our knowing 100% about this virus. We should have known X, Y, and Z, symptoms and whatnot. The challenge is that it's so new. Some of these heavily hit countries, they didn't have the bandwidth to even start assessing or reporting. They were literally in survival mode, people in the gurneys in the hallways. And I reported yesterday and the day before, we're seeing doctors coming together, the assessment of COVID toes and now the blood clotting component. That's all come together by doctors who started to assess some trends and then started to communicate and collaborate. That communication and collaborative effort, and then documentation and scientific research within the cases and profiles of patients, that allows us to get a broader based perspective. It's a higher level, it's a 1,000-foot perspective but sometimes boots on the ground don't always have that capacity. And I know there's a lot of frustration. I know a lot of people are frustrated, but I want to highlight the CDC has come around to bringing forth additional, I think it was six additional new symptoms. And I want to go over these because originally it was very aimed at respiratory, shortness of breath, and inability, so there was fatigue, but just really it was respiratory focused. Now we have, so it was originally fever, cough, and shortness of breath. Now they've added chills, repeated shaking with chills. Okay, so the rigors, that's very common. Muscle pain, headaches, sore throat, and then a new loss of taste or smell. I also want to highlight three additional symptoms, and they have listed this on here. But what they're seeing more and more people when they're on the intake forms, again, this is through collected data as people get admitted into the hospital. There's some other things that we need to assess. Confusion is a big one. And then the bluish lips or the bluish face. And so obviously that's lack of oxygen, but the confusion is a big one that I want to talk about as well. So one of the other kind of skin related, like muscle pain, even chills, there's this new description and people call it fizzing. People are experiencing this weird, like buzzing electric like feeling on their skin. And they describe it as it's like putting like a menthol or like an icy hot on your skin, and it's what that feels like. So I've dug into this, and the potential source of this is that as people's fevers are increasing, their body's detoxing chemicals are rising to the surface, and that might be the skin experience of detoxing. I'm sure we're going to learn more about this. So as soon as I get more data on that, I'll share that. But I want to highlight that because I think that's something. Another thing, 1 to 3% of the cases coming into the hospitals are presenting with pink eye. So that is another, that's not respiratory, but it's definitely in the upper, mucosal membrane. Pink eye is being linked, or is at least one of the symptoms that they're showcasing. So I think that's kind of interesting, but the confusion is really big. The confusion that people are experiencing, and this is all ages. Again, this is not, particular to individuals in their, 60s, 70s, 80s that might have dementia or Alzheimer's like cases. They're actually, this symptom is a byproduct of the virus and the inflammation in the brain. So the inflammation, the virus is in the brain itself. It's in the tissue. It's in the vascular channels. It's causing inflammation. We already know that the cytokine storm, I highlight that if you guys want to look at, we have a whole playlist here on YouTube. It is very, very interesting. So Cupcake Paper says the fizzing, buzzing electric is 5G. That's not been proven. And that is another topic that is getting banned on YouTube. So just FYI in terms of censorship. So just know that. I can't really get into that. I want to see more data, though. I will say that. Okay, Donna says, OMG, I couldn't remember my phone number or finish a sentence. Yeah. So that is brain-related inflammation. And the inflammation of the brain, we've talked about the anti-inflammatories. I have a lot of really wonderful products in my full script store that you can grab and utilize to help support reducing the inflammatory levels. Going back to our video sponsors, Vegetox, super greens, all of the particular items in here, particularly wheatgrass juice is a blood cleanser, barley grass, chlorella, spirulina, moringa. These are anti-inflammatory. So making sure you get your greens are very good ways to really enhance the anti-inflammatory aspect. But confusion, it's on here. It literally, like, they now have, when to seek medical attention. It's listed as trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse. There are a lot of And a lot, I don't know the number. I'm sorry. I wish I had the data. It's there. I just don't know that number. But there's a great number of individuals who are being found in their homes, and they're on couches. And when, some of the autopsy reports are drilling back that the blood clotting aspect, and that, by the way, that was a video from 2 days ago. So do check that out. And COVID toes, those individuals, they are at home. And that brought me to thinking, okay, so if you're at home, either you have been tested or you haven't, you might be presenting with symptoms. How can you successfully monitor yourself, especially if you're by yourself or even with family? But if you're with family and you may have it, you're in quarantine. So that's why I want to talk to you about the Pulse Ox, because I think this is a fabulous tool. This is what the hospital providers are using. And that's where they started to assess, when a Pulse Ox is like 15 or 25, where it should be in the high 90s, and people are like, la, 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 playing on their phone, checking out Facebook and, TikTok. By the way, I have a friend who's totally into TikTok. I get messages, TikTok videos all the time, and they're totally hilarious. But it's posed a question, because when you are presenting with a low pulse ox, these cases are seemingly fine. And so you might be seemingly fine at home. And if you're not monitoring your pulse ox, it might not register that you need to go and seek medical attention. And then also confusion's a whole nother dynamic to that. So that is something I wanted to highlight. I have highlighted the loss of smell and taste. The one distinction here is that the loss of taste is a different nerve center, different nerve pathway than the loss of smell. But part of it is related to the inflammation. It's partly related to the way the virus replicates, and also how we are exposed to it. We are often exposed through eye, nose, and mouth. And so that's where we see the greater instance of those cells, and then it triggers the immune response. Cupcake paper, my niece lost both taste and smell for 2 weeks. Yeah, it's very common. And the other thing too that they're starting to note, and again, I'm waiting for the data on it, but they're starting to analyze that individuals who lose taste and smell they often have a milder version. So maybe they were exposed to somebody who had a more intense more intense viral infection. And then husband, for instance, has really intense virus, down for 3 weeks. Wife, sister, family member, whomever, they lose loss of taste and smell, have mild fever, not nearly all of those symptoms of Rickers and other things like that. So I think that's very, very interesting. And Robert says, most of that sounds like the flu. Yes. A lot of viruses, colds will often mimic the flu, but this, just to be clear, is not the flu. And yesterday I reported, globally, we're at 2.7 million cases. We have 197 deaths globally. And, and here in the US, like I reported, we have over 50,000 deaths. That surpasses 7 of 9 flu seasons. So it's not the flu. The symptoms can be similar, but there's some uniqueness to these symptoms. And the other thing too is it affects everybody differently. So Donna says, I had a low pulse ox when I went to the hospital. And the CDC says pets can contract the virus. Yes. So Anga, that is absolutely true. I reported a few days ago 2 kitties in New York who had exposure either from their owner or life on the streets. I think it was just right by one of the articles. But they were exposed to it, and they came in with respiratory conditions. Okay, the real Charlie Orange says, I've been confused about that. When they say cases, they mean that those people have been 100% tested. Yes, that is absolutely true. So our numbers currently that I report every day, and I don't know if, so Facebook, if you guys have any questions, feel free to comment in the box below. I try and answer them as I can. So when I report cases, those are tested. I do hear from all of you and people I know that have tried to get tested, can't get tested, go to the testing sites, they run out. But yeah, the real Charlie Orange, these numbers are not just symptom-based. And we are still learning the symptoms. I mean, I think this is evidenced by the CDC just adding yesterday, the 6 new symptoms that we are starting to discuss. So, I had this week, I talked about COVID toes in one of our live show. The other show, I talked about the blood clotting aspect and the kind of overwhelming blood trauma that the body is showcasing. Strokes in young individuals, 31-year-old, 37, 38, 44-year-olds having strokes and big blood clots that, prompt amputations of legs like the one Broadway star. That I would imagine this might be another factor, but blood clotting, we aren't always able to be tuned in. But let's talk about, with my show, I always want to equip and empower you to be healthy and well. And empowerment means often building a toolbox of resources. So let's talk about a Pluse Ox. So this is a machine that literally you can buy at home. You can grab this or you can grab it online. There are some vendors that can get you this in a few weeks. Others, it's a little bit of a delay. Even, check out some of your durable medical supply companies. Some of them can sell online or you can go and pick up. But what you do is you literally put this machine, it's like a little kind of a paper clip, if you will, and you just put it on your hand, on your finger, usually the index finger, and you just wait and it will give you a readout. And so we'll just wait until my little readout comes out. But this is very powerful. Okay, so here we are. I'm right now, because I'm talking a lot, I'm at 96 in my oxygen and my heart rate is 86. So this is very powerful. When I did this, I think I took the photo, it was at 99 or 98. So this is a very good tool to measure where's your Pluse Ox. We use this, I think I mentioned to a lot of you that I hiked the Himalayas and got beyond high altitude for several, we were hiking for over 4 weeks, but we got into altitude and we were at altitude for, I think it was 2.5 weeks, and then extreme altitude for a matter of 7 days. So we carried these all the time. So we monitored and assessed our oxygen levels. We had doctor check-ins at, their check-in points that we had to analyze. And it was one of those very, very powerful tools for us to assess how are we doing. Because a lot of times if you're athletic or you're really, you exercise a lot or you eat well, you can feel like you're fine, but your oxygen levels might not showcase that. And that's the real indication, because you can be fine now, but people, in altitude crash. Well, the other thing about this particular virus, and as we're starting to see how the doctors in ER and ICU are starting to retweak some of the protocols, they're starting to treat some of the lung-related congestion and just the changes in the respiratory process, the lower respiratory process. They're treating it like high altitude sickness. And again, this is one of those tools that's very, very easy for all of you. So my question, Donna, so Donna, did you have a Pluse Ox at home? And were you monitoring this? So that's my question for Donna, who is at home. Lois, my Samsung phone has an app that measures pulse oxygen. Would you think it would be accurate? So that's interesting. I have seen vendors, and I've even been messaged by some of them, that they have a device like this that goes on the finger and it transmits to your phone. The question I would have is, how is it doing that? Like, do you put your finger on the app? But there's got to be some measurement for it. But yes, technology can be very powerful for us. And this is something that I think would be a very impactful resource for all of you to get. The other thing too, I think it's also impactful for any of you who have asthma, who have bronchial challenges, often get sick, or have any type of respiratory impairments, lung disease, COPD, the emphysema, and then also any of the radiated lung tissue. Those parties for sure need to have these at home. Anybody would benefit by this, especially if you, unlike us, we're staying at home, we're minimizing our contact. If you are out in the public, you're a frontliner, you're shopping for groceries, you're doing anything where you're exposed, this is going to be a good tool to monitor how you're doing respiratorily, if that's a word. So what is the best pulse ox? So there are a lot of different ones. I think right now, because supply is high, the demand is high, supply is kind of low, the best one is the one that you can get faster and sooner than anything else. So you might find these honestly, I'll tell you this, I don't think you'd find this at a Walmart or a Target. You might find these at Walgreens or CVS. I'd call ahead. As many of you know, I've announced the only time we've really kind of gone out, we've done like runs through Walgreens. They have now their little drive-through is open. Very, very sanitary, very social distancing. I'm a big fan of that. And I had Easter Sunday, I was making a dish and I had an ingredient I didn't have. So I called up Walgreens, was like, do you guys have relish? Because I don't have pickles. And the guy said, yeah. And so I said, okay, great. I'll be there, in a little bit. And he actually ran the relish to the pharmacy. And so she was like, you called, and she had it all ready for me. It was very cute. But you can call and then find out if they have these. And I think this would be very impactful for all of us to have. I mean, it is not a bad idea also to assess how are you doing on a daily basis, because the other thing too, the more and more I read about this, there's a lot of people, and I plan on packaging up some of my video content about like the most way to cough productively and how to expand and clear out your lungs and sleep, on your tummy to help your lungs heal and drain. And I showed that probably 3 weeks ago on a Sunday. Again, that's in a playlist that you guys can grab. Facebook actually posted it, I think recently. We might see Gabriel in a little bit. So why I mentioned that, there's a lot of discussion of, okay, all you have to do is just wake up in the morning and take a deep breath. And if you can breathe well, you're fine. That's not necessarily true. I do think that there are some really good lung exercises. There are some good ways to clear those passageways. I'm all for that. I'm editing a video right now that talks about, there's two kind of parts to it. One part is a lung chest poultice that I recommend using a lot of the products I've highlighted to you guys topically. But again, just don't rely on breathing to go, oh, I'm fine. Again, this is where this is most important. Tyler, hey, Tyler. Do you have any recommendations on COVID plus pregnancy, or would you consider that as a future topic? That actually would be a future topic. However, I actually have several moms that I know that are very close to term and are getting utterly, utterly nervous. And so this would be, and I know Tyler, this would be one thing. I would call your physician. First of all, if it were me in this situation, I would want to see there's ways or clinics where you can do outpatient related deliveries. So you're minimizing your exposure and you're not by yourself. That is a big thing right now, depending on where you're at. Tampa and the kind of those areas, you might be okay. But here in Atlanta, the COVID protocols, pregnant moms are laboring solo. So that's one thing. The second thing would be, and this, I do need to dig into this further. As far as pregnancy, it's this really weird question mark about women who are pregnant test negative up through to delivery. And then they test them again at 25 hours after delivery, they'll test positive. And the challenge, and I don't want to scare you, and I know, delivery has a lot of fears anyway, traditionally with women, but one of the things, the challenges that we're seeing with some of the ladies, the blood clotting factor, the blood clotting, the placenta delivery, all of that is a factor. So what I would do, Tyler, I'd see if you could have your OBGYN run your K2 levels, and you want to have those optimized as much as you can, because that will help minimize potential risk. The other thing would be like yesterday's video would be a good video to watch, where I talk about ways or actually 2 days ago, the blood clotting video. Omegas are really good, for keeping things moving and healthy. And DHA is very good for the baby. The other thing that would be impactful would be to look at adding not just vitamin K2, but vitamin D. Those two go hand in hand. Okay, cannot get rid of my chest cold using colloidal spray and probiotics and natural cough syrup. What are your thoughts? Is it just a chest cold, or could this potentially be COVID? That's the one kind of question that a lot of people are plagued with. If you're having a lingering chest cold, is it really a chest cold? So I would call your provider, talk with them. They'll run through symptoms, especially if you've been a little feverish, and see if maybe you get a test. Susan, good morning. Okay, so Donna, Dr. Melissa, why hasn't anyone mentioned using an insensitive spirometer? It's helpful, perhaps because I use oxygen. Oh, yeah, that's a good question. Dr. Melissa, can you please advise if it's okay to buy pet birds during these times? I don't see why not. In Gabriel's perfect world, he wants a hamster. So if we were going out and about, the pet stores are open. I do know that. So that would be kind of enter at your own risk. But, as far as I know, cats and dogs, we've seen transmission from human to animal. It's a likelihood that they can move into a bird. So I don't know if that's just for their safety or your safety. Okay, so cupcake paper. My niece is pregnant, and WVU has a separate tent for the check-ins. That's great. Yeah, and there are a lot of folks. Oh, James says congratulations with the baby. Oh, for Pat, yay. Okay, so is colloidal silver legit? Yes, it is. Okay, Sheila, you were tested and it was negative. Okay. So I have a lot of content on that. I want to kind of stay up on this particular content with this. But what I would say is, if you are experiencing any type of chest colds, poultices, oil of oregano in a carrier are very helpful. And immune boosting. Get your greens. Again, I have to give out a shout out to Vegetalks, our video sponsor. Yay! That's my smoothie that I'm drinking this morning. This is 8 superfoods. And again, superfoods are very powerful. Like the wheatgrass juice is very blood supportive. Spirulina has a lot of protein and very detoxing. The other thing too is, with cold, sometimes it's allergy season and sometimes it's internal allergies. I have a video I'm going to be shooting this weekend about keeping your homes clean and UV air filtration. I'm hoping now it doesn't get dinged because the whole UV thing, the comments recently about putting UV in your mucosal membranes or inside your body, which, by the way, there are treatments that are out there. They are on the newish side, but they are clinical providers, medical providers that are doing that. That is nothing that you would ever do on your own. And again, don't drink or ingest or intensely inhale any type of Clorox or disinfectant. That is absolutely not what you want to do and would cause more harm. What does this taste like? So it actually tastes like, here, I'm going to taste it again. It tastes great. First of all, my base is a non-dairy base. So I have oat milk. There's a blend of coconut and almond milk. It's kind of my protein smoothie that's just, or not smoothie, protein drink that has plant-based proteins in it. So I use that often as a base, and just banana and blueberry. And, the banana gives it some sweetness, but it tastes great. I mean, this, like a half a blueberry or half a banana, a handful of blueberries, about a cup and a half of, non-dairy free milk and the greens, and it tastes great. I will tell you, I drink a lot of green stuff anyway, and I love spirulina, and I actually use blue spirulina as well. So I'm used to the kind of taste to it. Now, if Gabriel were to drink this, he'd say it's a little gritty. but he doesn't like any of the powders in liquid. I do powders in his yogurt. So you could add this to yogurt or some other kind of liquidy kind of substance for him. He doesn't like to drink his powders. I'm fine with it. Brian would say, oh my God, I can't drink it. He wouldn't like it. Okay, so Emerald Style 17. Do you have recommendations for staying safe when getting a colonoscopy? I'm overdue for my annual procedure due to health history, but concerned about possible exposure from the hospital and staff. So, the big question here, and very similar to with Tyler, in pregnancy, I know that you can do some of these at outpatient providers or outpatient centers. See if you can do that versus being in a hospital setting. I think that does cut down the risk, but obviously there's always going to be a risk. And so, for my own personal health, like I got a call from one of my medical providers for a regular check. I said, you know what? I want to come in, but I'm not going to, and I'll call you when I feel comfortable, probably towards the end of summer. And so if it's absolutely not critical or essential, for some of the regular checkups, I'm pushing them out. But if they're, doing cancer screenings or it's a part of a protocol that you have to do it. See if you can move it to an outpatient center. There are colonoscopies, not all, all colonoscopies are not just being performed in the hospital setting. The other thing too, though, to that note is, not some of these would be considered elective, others are not. So that's something to find out as well, is even if that annual procedure has been sidelined based on your state or where you're at, because that is a big thing. The physicians will be in full PPE. So do expect you to see a very different kind of equipped, medical team, when you meet your doctor, the nurses, the anesthesiologist. All three are going to be wearing full on PPE. They're going to have everything. Same thing with pregnancy. It will feel weird, and that will be sometimes disturbing and anxiety producing for folks. And that's just the way the medical community is going to be operating, now and moving forward until we really get through this. Is Vegetox okay for pregnancy? It doesn't have anything that says on here any warnings, but I always, have folks check with their providers if they're adding anything new. But this is strictly green plant-based. It's not any type of vitamin, or nutrient mix other than it's quite plant-based. So super greens, really, really good. And they actually have their recipe adds in banana, mango, spinach, and then 2 servings of the super greens powder. But it's really amazing. It gives protein. It has fiber in it as well. I mean, but it's not too fibrous. Like, it's a good consistency for me. Oh, Lori, thank you. She says, I love everything Dr. Melissa recommends for us. Okay, Ivy, I did not hear about this. Okay, let's see. Lori, I got my Guru Nanda essential oils, love them, and my stress suppressed tea. Yay. Okay, so let's talk a little bit. Okay, so Jules, my daughter is due in 2 weeks. What is the K2 test and what does it show? So K2 is a vitamin. It is a vitamin that is often deficient, and the deficiency can cause blood clots. And honestly, my own preference, and I had our doctors do this, I feel like all pregnant women, especially towards the later term, should have that value assessed. Often when you work with midwives or doulas, you'll get a little bit of a different kind of testing methodology or approach, but K2 will tell us those values to minimize blood clotting before, during, and after pregnancy, or delivery. And one of the challenges in the US particularly is we don't monitor that value for pregnant women. We have an abnormally high morbidity mortality rate. And we don't talk about this. And this is something that is absolutely disturbing, but it's a first world country. We have the highest morbidity mortality rate of pregnant women or laboring, new moms. And some of it's from hemorrhaging. Sometimes we're too aggressive with like trying to have the placenta pass. It's a little too abrasive. And because of that, also women will state that they have problems and they get ignored, but it definitely does evaluate those levels. And then also if they're low, that can minimize blood clotting. But, the one thing, initially, there was a lot of communication that, oh, if you're pregnant, you're totally fine. You've got immunity or whatnot. Like I've heard a lot of these stories, and that's not valid. If anything, what's really bizarre is that, women test negative right before they have their child, and then a day later, they test positive. And I think some of that's just the natural body immune process. Oh, thanks, Cupcake Paper, $4.99 super chat. Thank you. Cheers, green drinks, yay. So that is something I think that it needs to be assessed more. Okay, so Deborah, hey Deborah, over on Facebook, she says, my husband tested on April 3rd. He was positive. They did not want to test me. See, that's a problem. Globally. I mean, just think about that. You guys are living in the same household. You've got exposure. We are sleeping in different rooms. For our safety, I suffer of asthma. Just a juicer. Breville, do you have any recipes for recovering? Yes. So I would for sure would grab a Vegetox for him and green juice, pretty much everything that you can get your hands on. All greens, ginger, lots of ginger. Ginger is anti-inflammatory, turmeric. I actually have a protocol. I'll post on Facebook. I have a protocol that I've kind of listed out. It's kind of the antivirus checklist. Those would be items. And again, a lot of those are in my Full Script store that would be in the catalog. You're going to want to use food plus really strong kind of functional medicine protocols, herbs, nutrient density, homeopathics, to address that. Let's see. Do I have a video on thyroid, Georgia Peach? Oh, yes. I have a whole playlist on thyroid issues, challenges, hypo, Hashimoto's. I also have protocols. They're all available in my digital online store. So if you go to my website, naturalhealthresources.com, you can grab one that suits your thyroid related condition. And I even have reflexology points that you can invigorate that help balance that. Very, very substantial protocol. It's very powerful. And I think you would like that. So those are downloadable, purchasable and downloadable via an email that gets sent to you. What is a pulse ox to go to the hospital? Okay, so that's an excellent question. Okay, so let's get back to pulse ox. And Deborah, I hope you guys, she said, sorry, I didn't say good morning. So we're just thinking about you and your husband. I know it's really scary, and, just do your best at, sanitizing as much as you can, really social, really quarantining. And the other thing too is make sure, and this is a radical approach, but if you're delivering food to his door, he'd want to be in a room the whole entire time. So, Brian and I have strategized about this. And then we even were like, okay, one of us would just go to a hotel. Because if you're in a room, you need a bathroom. You don't want to have that kind of exposure of like getting, some people don't have masters that have a bathroom attached, or it might not work for their arrangements. But one of the things is, really, really being careful, and, not to send him like a cup or glass, to have the throwaway type of utensils, throwaway, garbage, like we've been using these, or did initially when our kitchen was a wreck, before they put in our utility sink. We were using like the throwaway plastic plates and stuff like that. What you don't want to do is you don't want to be picking those up, washing them. That enhances your risk of transmission. And then the other thing too is I would recommend you get for his room a UV air filter, and at least that can filter out the air. You can't create negative pressure. That's the ideal way to kind of quarantine. but it would at least clean that air so that, the HVAC is going to be, your air system is going to be pulling his droplets and then moving it through the house. I know that sounds crazy, but that is definitely. Joy, welcome. I got in a few minutes late on the discussion of blood clots. Yes, so I actually have a live, so I'm doing live shows. This is like our 40. Actually, I think this celebrates, let me look at my calendar. This is a celebration. We have 1, 2, 3, 4, 5, 6, 7. This is my 7th week, friends. I've been going live to you 7 weeks. So that's how long we have been in quarantine. I said 6 weeks earlier. Holy cow. Anybody else losing days? That's not my memory. I'm confused. So Joy, I actually have a playlist on YouTube and I post them every day to my Facebook page. And you can see it has like a little heart with the little, heartbeat lines. Watch that video. That I dig further into it. But what I try to do for everybody new, and Facebook's new joining us, I try and stay to the topic at hand, and then every day is a new topic. But I really, really try and cover as much as we can to equip all of you, and particularly Deborah is an instance where, just to kind of give you up to date, Deborah has a husband quarantining at home. He's tested positive. She has asthma, so she has an underlying health condition that poses a risk. It's scary, it's nerve-wracking. And, so what I would do is Deborah, if you have a chance, go to some of the playlist and watch some of those specific related videos. I have, lung draining. I posted that here on YouTube. But that's very, very powerful, is to really be aware of some of that spread. And the likelihood is you might end up having exposure. Just how your body and your immune process handles that is the big question mark. So you want to do everything that you can just to fortify your body. Okay, so Jada says, is Deborah going to get corona? There's no way to predict that, but the best way to limit your exposure in that type of situation, and this is just on this. So Deborah, I don't want to call you out or pick on you or anything. We in the US are not treating this the way we need to treat this. So for instance, in other countries like South Korea, what they did is so for instance, Deborah's husband's test comes back positive. He doesn't go home to expose Deborah. He gets sent to an isolation quarantine hotel and he convalesces there. He has workers who have PPE and all the other stuff, and they're delivering food, and the food bowls don't even leave the room. He's in there, he's getting, whatever medical needs he has, but he's just hanging out and not exposing anybody. We're not doing that here in the US, and we're putting partners at risk. The likelihood of him being in this state could be 2 to 3 weeks. So financially, we said one of us would go to a hotel. That's if hotels are open and available. And, I haven't even looked into that, but that is definitely something that, as we get better, and that is like a big, if we get better with our testing, with our contact tracing, and then the isolation, that's what I presented earlier in the week. The huge kind of getting back to, I want to see if it's over here. Oh my gosh, you guys, I have so much information. Actually, it's over there, but I can't grab it. I put out the pandemic. There's a report that came out of Harvard. The School of Ethics put out this whole thing about like how to get back into normal mode. And it's about testing, it's about contact tracing, and it's about isolation. And how Deborah's family is being tasked to handle this is not the best approach, but there is no other option. And so, and she's like, exactly. So, and we just wish you all the best. So let's give some healing energy, send those thoughts and prayers over to Deborah, her and her family, that she's protected. Because I know, it's hitting home in a lot of different ways. And, we have, through all of my social communities, we have over 500,000 followers, patients, customers, And I do not want any of you to be in a situation where you are coming down with this virus, or has anybody in your family. I mean, it's rocking families. Okay, so Instagram, you're coming up on 15 seconds. We'll continue this. I'm going to answer a lot of questions. So if you guys are cool with that, give me a thumbs up. For YouTube, hit the like button. And Facebook, you guys, give me a like if you're liking this, and hit the share button. Share it to any groups that you guys follow. That does help us. And we actually have a private Facebook group as well that you can be a part of too. Okay, so we're going to bring Instagram back up. Let's see here. 5 to 2. Welcome back, Instagram, for part 2 of our Natural Health News live show, where we're talking about the benefits of using pulse oximeters, or oximetry. It's a pulse oximeter that will evaluate where you are in your oxygen levels. And that really stands to be a state of assessing your health at home. If you have have tested positive, if you think that you have the virus, there are just a lot of symptoms I went over today in part 1. So link down there where you can see this, but CDC's listed a few new symptoms that are a little unique and we're not hearing a whole lot about. So I'm going to answer questions here because we're in the latter half of our live show. Let's see, Lori, Lori says, I see no coupon, just a link to the site. I don't know what coupon, but let's see. We've got questions here. PO, pulse ox, to go to the hospital. So really anything in the low 90s, 80s would be indicative of going to the hospital. So I showed, I've been talking this whole time. So I'll show you my pulse ox. And Deborah says, it's not easy emotionally or mentally. My husband was unconscious. I had to keep yelling to get him up. That was the day, I'm going to read her, day of violent vomiting. I am ordering one of those too. And YouTube, I will post this. Okay, so I'm talking a little bit. So I'm at 97. Sometimes 90s, like there I'm at 99. So 96 is if I've talked for a lot and I'm not breathing, which happens a lot. But so if you're in the 92, 91, 90, low 80s, definitely that's when you call it. But you also monitor, keep a little chart, kind of monitor, when you're kind of dipping. Because the other thing too, it's not uncommon. Let's say you have the fever and you're up at 2 a.m. Well, you'll have lower pulse ox at that time frame anyway, just because of the way the body's slowing itself down. So just know that there will be different times of the day you'll have different measurements. But definitely if you're kind of consistently in the low 90s, definitely call. And then also you might see a dip. You could be in 95, 94, 95, and then boom, you hit 60. Okay, something's up. And if that's 60 reading for a while, that would definitely be an indicator something's going on with the respiratory element. Okay. My sister and mother-in-law are in ICU and on ventilators with COVID. Betty Schilling. Oh, Betty, I hate to hear that. Let us know, how are they doing and how long have they been there? And so you guys, Facebook, we have a commenter, Betty Schilling, said her sister and brother-in-law are in the ICU on ventilators. Yeah, I mean, it's affecting a lot of people and a lot of families. And, any way that we can equip ourselves with tools and resources that empowers us to stay healthy, again, like green powders from our video sponsor, Vegetox, or just staying up on our oxygen levels is critical. And it's critical in the nature of is it a difference of you needing dialysis for the rest of your life after you recover? Because people are recovering, but now we're going to need to also start talking about, okay, post-COVID. Post-COVID means dialysis, kidney dialysis, because the kidneys have been damaged because of the low oxygen. So Betty, you're getting virtual hugs, lots of loves, prayers, lots of comments over on our YouTube community. The mother tree said, fear will screw up your pulse ox, and there's a lot of that BS being spread around. Yeah, fear definitely, again, going back to breath, meditation, breathing can not only slow the heart rate down, but, what I will say, and I want to caution, the mother tree, I think it's the mother tree, low pulse ox in the 90s is not going to be fear-based. It's going to be virus-based. And so, we don't want to necessarily minimize true low pulse ox readings. In the 80s, 70s, and 60s, we're seeing the lungs starting to crash in terms of their ability to sustain healthy oxygen. That's going to be critical. All right. So, and Betty, I want you to keep us posted. We've got Lori saying, praying for you, Betty. Anaga's doing a little prayer emoji. Same with Darlene, sending healing prayers to all who are suffering from the virus. Jules and Cupcake, they're sending prayers. So, and Pat asked, Betty, do you feel the love? We care about you. So lots of love to you and your family, and stay strong and see if it's possible. One of the things that with families in ICU and on ventilators, the hospitals have Zoom. They've got mini iPads, like I've just got you guys all set up on Facebook, and see, keep in contact with those professionals as much as you can, and see if you do a video chat with them. They, even though it will seem like they're not responsive, they can hear messages from family. And that's one of the best gifts you can give your loved ones. It also is a gift for you because you feel like you're still staying connected to them. So just see if you can do that in the hospital. And that's for any of us, just to keep that, in the back of our heads. The ICU now is less engaging with patients than ever before. And so one of the things when they are going in to, do whatever work they're going to do with the patient, a lot of them are going in with tablets, and they're helping families connect with the loved ones. So, and that does require open lines with the healthcare center, the facility, the ICU, nurses, that will keep you abreast of that situation. So, there is not a coupon. So unfortunately, I don't have a coupon for the Vegetox, but gosh, it's good. And I'll just show you, if you guys want to look and see. So it's very beautiful. Look at this green color. See, it's nice and green. It's really, really pretty. I got to show you guys on YouTube, over on Facebook. Facebook's a little spotty. Okay, so Brenda Campagna, true or false? Immunity built at day 10 allows in-home medical provider to return to providing care. All 3 CDC guidelines met. She returned to work on day 14 from positive test. Seems false to me. So that's an excellent question. And I know that every healthcare system is treating this differently. The facilities, and it's also changing with our understanding that 20% of our healthcare providers are testing positive. So the question is, immunity built. The World Health Organization has cautioned against, there's no evidence that we have immunity built just because we've had it. We don't see any antibody testing right now that's showcasing herd immunity. So we also do know, and I've reported this, gosh, I can't believe we're on 7 weeks. I reported this probably like 4 weeks ago, where we know that we viral shed for up to, I think it was 72 days. It was either 58 or 72 days, but there is fecal viral shed and there is respiratory viral shed. And we see that in patient rooms that have been analyzed. We see that, even after the fact when families go home. Now, does that mean they're necessarily contagious, or it's just the virus kind of moving through the process of the immune system now getting control of it? That's a big question. So I think one of the things, Brenda, that question, I can't answer true or false, but I do know that some facilities are bringing people back sooner because they're short-staffed and they need, if you go down an ER nurse, ER doc, an ICU doctor or a nurse, or even, technicians that are doing CT scans of the lungs, or they're doing the oxygen treatments, the respiratory therapists, that's not an easily transitioned, skill set. So you can't just bring somebody in from like telemed or from, radiology. So that's a challenge. And that's, I think, one of the things that has shaped some of the medical facilities. It is different. We are seeing it's different also across the US. Okay. Yvonne, parents installed a medical grade HVAC filter, kills viruses and bacteria. Not sure if Corona was a few years ago. So we actually have one of those, and I still run UV in our house. We have 3 dogs, 2 adults and a child. And so I, regardless of that, the only thing I would say, unless there's a UV strip inside the ductwork, that HVAC, it's the droplets, we're just spewing those. So I would probably gauge, Yvonne, if your parents called the HVAC provider, that they would say that doesn't guarantee it. And in fact, I think they would probably do that legally as well. Okay, so Betty says, thank you. They need all the prayers they can get. And Deborah says, stay strong, don't watch the news. Totally. Okay. Viral spread. Oh my goodness. So we just need to be super careful that everyone is a carrier even after recovery. Yes, that's pretty much what, at least today, this morning in Europe, the World Health Organization is just really cautioning. I think too, there's a lot of discussion here in the US. I mean, we are the epicenter. I mean, we're the worst country at this point dealing with this. And so we are definitely dealing with a lot. And because of it, they're also watching what's being said. And also what, I think there was something like, I want to say it was like 47 different tests kits that have been passed by the FDA, like really fast. And these are going to be testing kits for the virus and antibody tests. All right. Brenda says, thank you. Since mom is homebound, we wish that they would have sent other in-home provider because they have additional ones. Provider didn't wear a mask. Oh gosh, on return to work until we requested she do so. Yeah. So, some of the challenges with home care, and that's like another aspect too that we're going to start to see. And I know some friends here locally that they have PICC lines and things like that. Some patients as well, cancer patients that are getting administered medications at home through IV. One of the challenges is that home care providers tend to be the least equipped and provided for in terms of safety for not just themselves, but also the patients they're dealing with. So, in that type of situation, I would call the provider and definitely demand that, but also be equipped with that at your own home. Because the likelihood is they're wearing the same mask from home to home. And then also I'd make sure that they take their shoes off before they go into your house, so that they're not bringing in the droplets on their shoes. I know that sounds crazy, you guys, but I mean, we just really have to be very cautious, especially when we have at-risk individuals in our homes and our families. We have to do everything that we can to equip them to be healthy and safe. So I see 2009 BA, open doors to home. Will that help? Well, I definitely think opening and airing out a home is always impactful, just to clear things out. Just be cognizant, like if we do that, allergies are here. So as soon as we close our windows, I've got a whole aisle of my air filters, pretty much every room, upstairs, downstairs. Very, very critical that we keep clearing that out. AW, first time here. Oh, welcome. I hope you follow and subscribe, join our community, and hit the notification bell for all of you. Because then you actually get notified when we go live. You can subscribe and that bell will be off. You want to turn that on for all of you who love our content. So you are very informative. How long do droplets last on soles of shoes? So depending on the type of shoe, it could be rubber, it could be metal. So the material itself is the variable, and anywhere from 3 to 5 to 7 days, depending on the type of material. So that means that you want to have outside shoes if you're going about shopping or whatnot. Take them off. Take off, your clothing in like your garage with the garage door closed. have a paper bag, you put that in to be cleaned, and shower, washing your hair and showering. And, I always say, do your nasal spray, the saline spray, just to clear out and cleanse your sinuses too. Let's see, my nurse or OTPT won't take off shoes. My house is clean. Oh my gosh, I would demand that. Yeah, Donna, and I would even put a sign at the door. All medical, professionals, take your shoes off, and even have like a little cardboard basket, or like cardboard box, have them, put that in. Because here's the thing, cardboard, the virus dies after 24 hours on the surface. So that's one of the easiest, like mails and that same kind of category of cardboard paper. Let's see, the real Charlie Orange says, we wear all white and then bleach the clothes and do everything you mentioned. Excellent. My husband, Marietta, my husband works at Hyundai and Kia automotive plant in Tallahassee, Alabama on Monday. Not sure if this is going to be safe. I know. Yeah, providing booties, Alexi. What I would say, if you did provide booties, still have them take their shoes off. And then the booties they would put on as they get inside, and then take them off outside. And then they swap out their shoes. Like, we actually have a center, we have deliveries and stuff. I have a little center that we made right by the door, and I have hand wipes for all the professionals that are delivering stuff to us. I give away hand sanitizers. We have snacks. I have masks. I have gloves. And I buy more every week, or, however often I have an Instacart shopper or online. And that's for these folks, and they take what they need. And I value that, because if you can give them things to help them, they will use them. Hand sanitizer too. I would, have a little station outside. If you've got medical people coming into your home, have a little hand sanitizer spray or whatever, Clorox and I say Clorox, but, I mentioned forces of nature is what we use inside. Not everybody will know or even think that that's what is going to help them. So you can obviously have that and use it in your house, because it is very powerful at cleaning. But, Clorox wipe thing, and just little notes, like we've got taped on. I use my little Post-it notes, tape on, for your, to clean your hands. And then, we have a sign, thank you for everybody delivering. We appreciate your work. We have snacks and healthcare stuff for you. So Alyssa, I will post, Aaliyah is where I've been getting the majority of my hand sanitizers, and then sometimes hit or miss. I've been able to get some smaller independent ones from my Instacart person that goes to Sprouts. Sprouts is like my go-to. So they got me all of my Clean Well sanitizers, and they're, a little expensive, but to be honest with you, these people are doing the job that I don't want to do. And I would, know that they're putting their lives at risk, delivering and coming into people's space. And so any way I can support them, I am going to do that. Can the shoe covers help wearing them to store when purchasing food? That's actually an excellent question. So I think the material, I know the material on the covers, they're not, so droplets basically are water, snot, mucus. I know it sounds gross, but that's what they are. And the heavy ones fall their gravitational pull, it pulls them down. So there's a lot more viral spread on the floors than anything. But it's circulating, it's aerosolized. So it's circulating in the air for 2 to 3 hours after somebody infected has breathed in that space or coughed, and that is why the mask is not necessarily about the person, it's about everybody else. So they cough, it minimizes just how much is coming out into the space. And if you guys want, my friend Sarah, she's still making masks. I have all of my, Etsy store links down below. Sheila, you can order this at www.vegetox.com. And this is so good. And then you just add it to your smoothie like I have. So I would say, Deborah, on that front, I don't think it would be absolutely protective. I think the most effective way in the car, you could have your shopping shoes, and you could have a cardboard box in the back of your trunk. and you know, have your, you know, inside your car shoes and your shopping shoes, and you could do a swap in the, you know, I haven't shopped, but this is what I would do. I would have in my trunk, we have an SUV, so it pops up. So I would have a box where my normal shoes would be. And then I would probably have my plastic flip-flops, you know, driving that, you know, I'd get out of the car, walk around. And again, just think about there's droplets going to be in the parking lot too. So I would have, really, you'd have 3 pairs of shoes. One that you'd be wearing in the car to get out to swap into the shopping shoes. Your shopping shoes, shop, and then when you get back to the car, take them off and stick them in the cardboard box. Again, cardboard, if there's transmission, 24 hours, that's dead. But you'd have to clean the bottom of your shoes either when you get home or there, whatever. Have a little, again, a little sanitizing station for your hands. I actually am going to share on tomorrow, there's a vendor that I found that they actually have these really great little hand soapy wash things that are on the go that are great for this type of situation. So that would be something I would do. And then you could swap out your shoe. I mean, so there's still going to be exposure in the parking lot, but it's a whole lot better than your Trader Joe's, Target, CVS, Walgreens exposure. And I know that sounds really crazy, and people have given me flack about how diligent that sounds or detailed, but we really have to think about where these droplets are. We don't see these. So because we don't see it, we can't assume it's not there. We have to assume it is there. And these droplets are so small, they're in the air, we can't see them. And I shared, you know, with you all on the live show weeks ago, the droplets, like the spray goes 23 to 27 feet. So a sneeze can extend 27 feet. That could be 3 aisles over, you know, at a shopping store. Elizabeth, Dr. Melissa, I live in upstate New York. My dad was rushed to Albany Medical Center yesterday with 102.3 fever. They said they couldn't test him and sent him home. Oh my goodness. I'm sorry to hear that. Get him a pulse ox. Here it is. Make sure he has this and has that he's monitoring. Call the pharmacies. Excuse me. Okay. Let's see. Alexi, when I walk my dog, I don't wear a mask. I stay away from anyone I see heading my way. Everyone is being very conscientious of staying more than 2 meters apart. So here's the thing, again, because of the spray, you should be wearing a mask. You know, the mask, there's a multiple kind of degree of powerful masks. Some are just going to protect others from you, and then others can protect others from you. So I'll go over that. If you guys want that on a live show, I can do that. I've also thought about putting that together in a YouTube video. Kay Jefferson says, sanitizer is slow coming back in stock. I was able to get a 32-ounce container online from Walmart. Also from the honest companies. Yeah, that's great. Yeah, so slowly supplies coming back in. I scored toilet paper on Monday. I was like, oh, I swear I should have played the lottery. I might have won the Powerball. Does UV sanitizing disinfect the masks? I bought UV sanitizer, small boxes for sanitizing masks and keys. So it depends on the manufacturer. I have to look at the clinical reports of it, but there are things for the phone and wands and stuff like that. But again, that is for objects, not for the body. Can you spray the bottom of your shoes with Lysol or Clorox before touching the gas? Yes, you could. Ann Lynn says, can you spray the bottom of your shoes with Lysol or Clorox before touching the gas and brake pedals? Yes. And that would be something too. You know, just think about like, you know, like the side, when you get in the car, sometimes your feet kind of touch like that little side thing. You could clean that, spray it. We honestly, if we get plastic, I'll just spray it and leave it. I don't even wipe it now. Okay. I do have an N95 mask. I know you hate it, but it's better to hate that than hate being in an ICU all alone. And I don't say that in fear mode, but like the alternative, you know, because this is what I love our neighbors, and we live in a great community. I don't trust anybody. I don't trust people to take care of themselves as much as I would take care of myself. And that might come off in a negative way. And I'm sorry if it sounds terrible, but I have a certain standard for our health, and I don't always feel like other people would respect or value that standard and might not approach me or my family with that degree of a standard. And so we just have to take ownership and make decisions on our own. So our decision, we're not going back to work in the work mode. We're still working from home. You know, we're questioning school. We don't know what's going on with school. Summer camps probably aren't going to happen. You know, Brian's like, let's just consider fall off. You know, so we got to figure out tuition and stuff like that with Gabriel's school. But it is kind of, you know, there's just a lot of stuff to think about. Kathleen says, when my mom dropped into the 90s on the pulse ox, she would start sounding a little confused, almost drunk sounding. Something to listen for. That's excellent. Yes, and that's a good point. It'll come off almost like they have a diabetic crash. And there's sometimes that correlation with the kidneys too. And that's another thing, is to monitor their blood sugar to see when O2 oxygen levels fall, you'll start to see some changes in their blood sugar levels. Okay, so Taryn, I feel the same way. I don't trust others. This is not the time to let your feelings or your guard down. 100%, totally. Saludos de Uruguay, muy guapa. Yay, thanks for joining us. Let's see, has anyone heard of the Jaws disinfectant? I have not. All right, so I'm going to wrap up our show today. But first, definitely want to thank our friends at Vegetox. This is a great green juice. Comes out of the UK. One of the things I like, this is, again, dairy-free, GMO, gluten, dairy-free, no sweeteners, no fillers, no additives, no preservatives, nothing artificial. It's just clean green powder. And also think about the standards in the EU and Europe, a lot different than here in the US. So, but yeah, so friends, tomorrow, Facebook too. I'm going live again tomorrow morning. I will probably have my quarantine and caffeine. I'm drinking my stress relief tea. I don't know if you guys can see this. Kind of hard Facebook. I just spilled. Yeah, I knew that would happen. So what I'm going to do is tomorrow is usually a little bit more casual for me here, but Facebook, join me again at 9 a.m. This will be a weekend endeavor on Facebook, YouTube, and Instagram. We're coming back. I'm going to clean up my desk, and I hope all of you have an awesome, awesome Saturday. If you don't follow me on Instagram, I hope you do. Natural Health Resources. I'm going to be out in my garden a lot. So I'm going to change into my garden mode, and it looks like it's really nice weather out right now. We're supposed to get rain tomorrow. Oh, the little chipmunk is eating up my feeder. They are cleaning me out. I swear, the squirrel and chipmunk are going nuts. So anyway, follow me on Instagram to see my weekend adventures. And I hope all of you have a wonderful, wonderful weekend. Thanks for tuning in. Please give me the like button, share it, Facebook and YouTube. Instagram screenshot, tag me on your stories at Natural Health Resources. Thanks, everybody. I will see you all later. Bye. Bye, Facebook.